This medication is commonly used to relieve mild to moderate pain, such as headaches, toothaches, and backaches. It can also help reduce fever caused by colds, flu, or menstrual periods. The recommended daily dosage for children is based on their weight, and it is important to follow the instructions on the packaging carefully. It is best to take this medication with food to help prevent stomach upset. Always consult with a healthcare professional before giving this medication to children. When taking junior pain reliever, it's important to follow the directions on the product package. Be sure to use a product meant for children if you are giving it to a child. Use your child's weight to find the right dose, and if you don't know their weight, you can use their age. For suspensions, shake the medication well before each dose. Some liquids do not need to be shaken before use. Measure the liquid medication with the provided dose measuring spoon/dropper/syringe to make sure you have the correct dose. Do not use a household spoon. If you're taking rapidly dissolving tablets, chew or allow them to dissolve on the tongue, then swallow with or without water. For chewable tablets, chew thoroughly before swallowing. Do not crush or chew extended-release tablets, and for effervescent tablets, dissolve the dose in the recommended amount of water, then drink. It's best to use pain medications at the first signs of pain. If you wait until the symptoms have worsened, the medication may not work as well. Do not take this medication for fever for more than 3 days unless directed by your doctor. For adults, do not take this product for pain for more than 10 days, 5 days in children, unless directed by your doctor. If the child has a sore throat, especially with high fever, headache, or nausea/vomiting, consult the doctor promptly. If your condition lasts or gets worse, or if you develop new symptoms, be sure to inform your doctor. And if you think you may have a serious medical problem, seek medical help right away. If you experience any unusual effects, it's important to contact your doctor or pharmacist right away. Your doctor has determined that the benefits of using this medication outweigh the risk of side effects. Most people who use this medication do not experience any serious side effects. While it's rare, a very serious allergic reaction to this medication can occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling of the face, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you experience any other effects not mentioned here, be sure to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects, or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. When taking junior pain reliever, it's important to be mindful of the amount of acetaminophen you consume. For adults, the recommended maximum daily dosage is 4,000 mg, 4 grams, but if you have liver problems or are giving it to children, you should take less. It's crucial to consult with your doctor or pharmacist to determine the safe amount of acetaminophen for you. Additionally, you should not take junior pain reliever with any other medication containing acetaminophen without consulting your doctor or pharmacist first. Acetaminophen is a common ingredient in many over-the-counter and prescription medications, such as pain and fever drugs or cough and cold products. Always check the labels on all your medicines to see if they contain acetaminophen, and ask your pharmacist if you are unsure. If you accidentally take too much acetaminophen, seek medical help immediately, even if you feel fine. Overdose symptoms may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing eyes/skin, and dark urine. It's also important to note that daily alcohol use, especially when combined with acetaminophen, may harm your liver. Therefore, it's best to avoid alcohol while taking junior pain reliever. It's important to talk to your doctor or pharmacist before taking junior pain reliever if you are allergic to acetaminophen or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems. Before using junior pain reliever, be sure to tell your doctor or pharmacist about your medical history, especially if you have liver disease or if you regularly use or abuse alcohol. If you are considering using the liquid, chewable, or dissolving/effervescent forms of junior pain reliever, keep in mind that these products may contain sugar or aspartame. If you have diabetes, phenylketonuria, PKU, or any other condition that requires you to limit or avoid these substances in your diet, be sure to talk to your doctor or pharmacist about using these products safely. If you are pregnant, it's important to talk to your doctor before using this medication. Additionally, if you are breastfeeding, be sure to consult your doctor before taking junior pain reliever, as acetaminophen passes into breast milk. Drug interactions can affect how your medications work and increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with junior pain reliever are ketoconazole and levoketoconazole. It's also important to note that this medication may interfere with certain lab tests, which could result in false test results. Make sure to inform lab personnel and all your doctors that you are using junior pain reliever. If you suspect an overdose and see serious symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can reach your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of overdose may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing eyes/skin, and dark urine. Acetaminophen, the active ingredient in junior pain reliever, does not cause stomach and intestinal ulcers like some other pain relievers. However, it does not reduce swelling like those other pain relievers do. It's important to consult your doctor for more details and to see which medication might be right for you. For children, the daily dosage of junior pain reliever should be determined by their weight and age. It can be taken with or without food, and the optimal timing for taking it is as directed by a healthcare professional. If you forget to take a dose of junior pain reliever on your regular schedule, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed dose and take the next one at your usual time. It's important not to take a double dose to make up for the missed one. Make sure to store junior pain reliever at room temperature in a place that is away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When it comes to getting rid of the medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it's expired or no longer needed. If you're unsure of how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.